Stephanie's liver transplant took place 22 years ago. Chronic inflammation of her liver had led to scarring of her bile ducts and subsequently to cirrhosis. When I was 10 years old, I was diagnosed with inflammation of the large intestine. Quite quickly after that, the diagnosis of primary sclerosing cholangitis came. After another 10 years, the condition of my liver was so bad that I needed a new one, and I've been living with that one for 22 years. In the case of Hans, the transplantation was only 7 months ago. The reason was quite different for him. He had liver cancer.
The doctor's prognosis was the only long-term prospect of survival is a liver transplant. On 20th of October, I received a call saying we have a potential donor liver. I drove to Hamburg, the transplant was done on the 21st, and 15 days later I left the hospital in a good condition.
These two different cases show how life can look after a transplant in the short term and in the long term.
Both patients really had a very good course after liver transplantation. This is commonly the case, but of course not always. There are also other examples where patients have a lot of complications in the perioperative period and have to stay longer in hospital. Over the time, usually problems get less and less, and patients who are very adherent with their medication and with their follow-up visit usually have a very good course after liver transplantation and can live many years with their transplant.
In the year 2019, 7,900 liver transplants took place in the European Union. 10 years after a transplant, 70% of patients are alive. This requires lifelong immunosuppressive treatment. The tablets that prevent his immune system from rejecting his new liver are now also part of his life. Hans got used to it quickly.
They changed the type of immunosuppressant twice, and I take the tablets once every morning. I have a huge stock of tablets because there are also other things for blood pressure and whatnot, but it's all completely tolerable and no problem. The important thing is that you actually take them every morning.
The most common indications for liver transplantation are autoimmune liver diseases, alcoholic liver disease, steatohepatitis due to fatty liver, and chronic virus hepatitis. All of these lead to cirrhosis and liver failure. Another indication is liver cancer, as in the case of Hans.
There are also rare metabolic liver diseases which may require liver transplantation. This is particularly the case in pediatric patients. Adult patients rarely have metabolic diseases requiring transplantation, but an example would be Wilson's disease or hemochromatosis. In addition, we have patients who had an acute liver failure, which is a disease which develops rapidly, and these patients do not have any underlying liver disease to start with. They may need liver transplantation within a week after onset of their disease. Very often these are toxic hepatitis patients, so they have drug toxicity, for example, or it may be due to mushrooms or other poisoning stuffs for the liver. But other causes involve autoimmune hepatitis or viral hepatitis, for example.
If there is indication for a liver transplant, it must be confirmed in each individual case during the evaluation. There are numerous medical examinations that take place during an inpatient stay at the transplant centre. The aim is to find out whether transplantation gives the prospect of success in the individual case, or whether there are contraindications that speak against transplantation. Once it has been decided that a transplant should take place, the patient goes on the waiting list for a donor organ. This can mean an anxious wait. Hans remembers this time clearly.
There was no precise statement about when the liver will be available. So you have to live with the hope that it will come in time. For me, it was easiest to bridge the waiting time by continuing my life exactly as I had done before and simply telling myself that it would come, because you have no influence over the timing.
Organ allocation is based on urgency in most European countries. This means that always the patient who is sickest and has the worst prognosis without a liver transplantation receives the next graft offer. This is important because, of course, we don't want any patients to die on the waiting list. But on the other hand, since we have so few organs, that means that some patients really have to wait a long time until they get an organ offer. And it may be really difficult to cope with this and to wait for this organ so long and to know that if one gets worse and weaker, that then the transplant may be more difficult and it may take longer to get well afterwards again.
After 2.5 months, Hans got the call he had been longing for.
I never expected it to happen so quickly. I wanted to go about my normal workday in the morning at around 9 o'clock. Then the phone rang. "We have a liver for you. You have to be here at 12. I dropped everything, jumped into the car and drove to Hamburg.
For Stephanie, it was a long time ago, but she remembers it well. I got on the transplant list when I was 20 years old. I was told once after about 6 months that an organ was available. Unfortunately, it wasn't right for me, and in the end, it took 10 months. Then in October, I was given a liver transplant. When a suitable organ is found, it is transported to the transplant center by the fastest route, in case of doubt, across Europe. The operation then takes place at any time of day or night. This is followed by a stay in the hospital, which usually lasts 14 to 21 days. In some cases, it can be shorter. And then a phase of inpatient rehabilitation takes place to practice living with the transplanted liver.
The perioperative period after liver transplantation is really the most important period. So in the first days, usually the patients are on the intensive care unit, and during that time, the liver has to start working. Any complications which may develop, like infections or rejection episodes, should be picked up in time. So patients are very closely monitored. We take blood samples every day, and whenever there is a complication arising, we treat it in time.
Hans is recovering without any problems. He is leaving the hospital just 2 weeks after having had the operation.
I came out of hospital in a good condition, apart from weight loss. There was basically nothing wrong. It hurt a bit, but that's just the way it is. And within 2 months, I had so much performance again that I could go about my normal everyday life more or less as usual.
It is quite common that a patient who undergoes liver transplantation for hepatocellular carcinoma has a very easy course after liver transplantation and is able to be discharged within just 2 weeks. But of course, this also means that he still has to come in as an outpatient then for follow-up visit.
Especially in the first period, it is important to recognize and treat possible complications at an early stage. Above all, to protect the transplant. Shortly after transplantation, thrombosis of the liver vessels may occur, but that can be treated. Other early complications are CMV or fungal infections, for example. This risk is due to baseline immunosuppression. A leak may occur at the new junction of the bile duct, or the patient's own immune system may lead to an acute rejection of the transplant. Acute rejection is defined as rejection within the first 90 days after transplantation. This occurs to a greater or lesser extent in 1/3 of patients. Flu-like symptoms, jaundice, or discoloration of the stool or urine may then occur. Hans experienced CMV virus infection early after his transplantation. He had caught it, and because his immune system is suppressed, the virus could make him sick.
I was CMV virus-free when I was operated on, but the donor had the CMV virus, so I got it. And that led to a phase where I was suddenly very sleepy and tired, and I felt listless. That was maybe 4 months after the operation, but the hospital reacted immediately, prescribed me a medicine that works against this virus, and after another 14 days, 3 weeks, this feeling of being sleepy and tired is gone. So basically, I don't miss anything anymore.
Schlapp sein, müde sein, weg. Also mir fehlt im Prinzip nichts mehr.
For Stephanie, the main problem in the early phase was rejection. Such phases occurred several times. I was aware that something like that could happen. I had also been informed of it. And of course you are scared at first, no question. But it always went very quickly. The side effects like fever were first reduced with the medication, and accordingly, the transaminases always went down quickly. I always responded very well to the treatment. Immunosuppression, the dampening of the body's own defense with drugs, is definitive in maintaining a transplanted liver. The medication must be taken for life to protect the organ. The most common immunosuppressive drugs are the calcineurin inhibitors tacrolimus or cyclosporin A. Additionally, mycophenolate mofetil may be prescribed. Alternatively, the drugs everolimus and sometimes azathioprine are used. All of these dampen the activity of the immune defense. If immunosuppression is too weak, this can lead to creeping rejection. In 2% of liver transplants, chronic rejection happens later on. It is often due to a lack of adherence to the immunosuppressive medication. It is a challenge to take tablets without any time limit, but chronic rejection is a big risk because often there is damage of the transplanted liver that goes unnoticed.
Chronic rejection develops slowly and very often unrecognized. The liver function tests may not be very high, and it may happen that patients develop cirrhosis again without us noticing it in time. So it is very important to do special investigations like a fibroscan and ultrasound in regular intervals. And there may also be indication for a liver biopsy, again during the follow-up over the years, to be sure that there is no chronic rejection and to adapt the immunosuppressive medication appropriately.
Follow-up means long-term care at the transplant centre to preserve the organ, but also to improve the quality of life. This involves regular medical examinations, which include screening for malignancies, as immunosuppression increases the risk of malignant diseases.
Liver transplantation is really a great option for a patient with a life-threatening severe liver disease to get healthy again and to get back to almost, I would say, normal life. Of course, patients have to take their immunosuppressive medication lifelong. They have to take the medication regularly, and also they have to go to follow-up investigations regularly. But we have a lot of patients who underwent liver transplantation more than 25 years ago. They are doing very well. So liver transplantation is really a chance to go back to our normal life, and many patients celebrate the day of their transplantation as their new birthday.
While Hans is at the beginning of life with the transplanted liver, Stephanie is very experienced with it.
Dadurch, dass ich in der zeitlichen Kette
Because I received the right examinations with a bit of luck in terms of timing, the final result was positive without any problems.
problemlos zu einem positiven Endergebnis geführt hat.
And I owe that to those people. I was in good hands.
I'm grateful when I think about my transplant, but I also feel a little sadness for the family who lost somebody that made it possible for me to go on living. It might sound cheesy, but really, it really is. I'm really grateful.
Ich bin wirklich, wirklich dankbar. Thank you.